Let's discuss this now with the co-founder of the Treatment Action Campaign, Zackie Achmat. Zackie, a very good afternoon to you. Thanks very much for your time. When the minister, I watched the briefing from start to finish. He spent a considerable amount of time going back in time, talking about where we have come from as a country with respect to the fight against HIV and AIDS, successes we've been able to secure over the years, and just how resilient our program has been. Of course, one must add that due in no small part to the activities of organizations and people like you. And it was on that basis that you were saying there is no way that at this late stage, with all the achievements, we can allow or what we've managed to do over the past 15 years at least to collapse, and that is not about to happen.
Well, it's very important to look at history, and it's very important to look at facts, at fiction, and truth. And sometimes they all feel a little indistinguishable, especially if it's a receded 20 years and 50 years and 100 years. I'd like to start with Minister Motsoaledi's role in our politics. During the early years in politics, he was an MEC in Limpopo. He played an enormous role in our political struggle. After Barbara Hogan became health minister and really kicked off the HIV program in 2008 into 2009, when President Motlanthe became the president, at that point, after the next election, Dr. Motsoaledi took over the HIV program. If we look back in 2004, when the program started, not 2010, 47,000 people were on treatment. 37,000 of those were in the private sector and in NGOs. By the time Barbara Hogan took over, it was 600,000, with the majority in the public sector. In 2010, at the end of 2010, Dr. Motsoaledi put over 1 million people on treatment. And by the time he left, the health department, 5 million people were put on treatment. And that is no small measure, like you say, it's in no small measure, happened because of the struggles of doctors, of nurses, of clinicians, of Lusiki's HIV program, Kailicha, Gertsebandi, and so on. People worked, and the political struggle, which started in 1998 to get us a program, right up to 2009, 2010, was instrumental in setting the foundation for what we have today. Dr. Motsoaledi did a sterling job. I thought my work was over in the field of HIV. I really did think so. Now, so for that, one must give the minister credit. The other problems with the health department, let's not touch that. I'm focusing on HIV here. When we look at what happened with PEPFAR, what was really almost impossible to understand from the minister is that he said that people like myself, he didn't name me, but I associate myself with a critique of the government, particularly national government, in relation to PEPFAR. He said that we were celebrating Trump's cuts. Now, let me tell you, you know this. My clinic is shut. My clinic is shut. In order to get a transfer, I have to go to the clinic when there is someone, but that clinic is shut. My new doctor will have to write to the doctor there that remains only for a few hours to get my file. Now, I'm one of the lucky ones. I really am one of the lucky ones. I would like to hear from Dr. Motsoaledi. So many hundreds of containers provided by PEPFAR, which are now shut for TB patients and for people living with HIV. Those containers, this is the amount of money we're going to need them to bring them back into operation. This is the amount of PrEP that the state provides, and this is the amount of PrEP that PEPFAR provides. This is how we're going to get to there. You can imagine one of the biggest losses that we have, or the two biggest losses that we have in human power or work power, is this. The people who go out to communities to test, proactively find people and test them. Test men at the men's clinic, also shut down. Test sex workers, test lesbian and gay people, make sure that people who cannot be reached are reached. Those clinics are shut down, and that staff is gone. They form part of the 8,000. Similarly, the people who ran antiretroviral treatment clubs to ensure that people remain on their medicines. I've been on ARVs now since 2003, September 2003. I take my medicines every day, and that means I'm not infectious to anyone. But if I interrupt my medicines today and I start becoming sick, my viral load will go up. And if I have unprotected sex, I will transmit the virus. Now, those antiretroviral clubs have been shut down, and they were particularly focused on youth and men. And therefore, what I would like to see from the minister is a clear plan that comes for all the metros. City of Cape Town, I still need to see their plan. City of eThekwini, we all need to see their plan. The metros in Gauteng and so on, as well as all the 9 provincial governments. The minister, I can't understand this because he's been an executive authority responsible for the PFMA since forever. And yet he says he doesn't know section 16 of the PFMA. I could recite it to you backward because of the question of emergency funding. The minister could literally go and get 2 billion rand from Treasury today as an emergency stopgap measure, if he had a plan. Now, the fact of the matter is, we heard the news in January, 21st of January, when I woke up, I heard the news. We are in May, at least 4 months. Now, for me, the failure of the minister there cannot be covered up by any amount of bluster, misstatement of fact, misrepresentation, and so on.
Just a couple of things. If I may, Zach, if I heard him correctly, he wasn't saying people like you were celebrating, but rather that Trump's decision to withdraw funding is not something to be celebrated. He was also taking exception, I have a personal view on this, but to people criticizing him, saying that he launched Closing the Gap without a plan and without any funding. Then went on to say the government has since prioritized 659 million rands from the HIV/AIDS conditional grant to support their campaign. He also said that they have gone to everyone they could go to seek assistance, but so far they haven't received positive responses, except from the World Fund that has actually allocated money, over $1 billion, but for antiretroviral drugs.
Vuyo, just perhaps I would recommend you go back to the record of the meeting. I have a transcript which I can read, but I don't need to. He did say we celebrated, and he said that those of us who criticize are like AfriForum. So just on that matter, first, over the last 2 budgets, not this one that hasn't been decided, had cuts in the HIV budget, significant cuts, particularly in relation to antiretrovirals. The minister is throwing around a series of numbers. These numbers aren't put before us, the public. people like myself who are activists. This is not put out in the public domain and said, here's the plan, here's the 650 billion rand, this is where it's going to go. We don't need 650 billion rand to ensure that adherence, that people who fall out of the system are welcomed back into it. We don't need that. So I think what I would urge is for Parliament to have a hearing in order to get the plan. We must get this plan. If we don't, it's not a question. The health system, honestly, in Eastern Cape, I'm talking about the whole health system, in Eastern Cape, Mpumalanga, Limpopo, and increasingly in Gauteng, is collapsing. And some people would say more than that. Now, if that's the case with the general healthcare service, the one part of it that really did work was the HIV and TB programs. So I would ask Parliament and ask the Minister, let's sit down and work on 9 provincial plans and plans for all the metros to make sure that we don't have to fight. I want to fight Donald Trump and Netanyahu. I do not want to fight. I mean, you know, when COVID happened and President Ramaphosa came out, whatever criticisms we may have of the COVID response, I felt that is my president. Because it is that openness to the whole of society, reporting on a weekly basis. And I mean, we joke about the fireside chats, but reporting on a weekly basis what is going on. The health minister reporting almost on a daily basis. Now, obviously, the crisis is not that dire in order for us to get a weekly report from anyone or a monthly report. But a quarterly report would do. But be upfront and communicate. The confusion that exists is very strong.
Well, he was at least upfront about the fact that he doesn't know what's going to happen to people who have lost and including those who are bound to lose jobs after September, jobs which were PEPFAR supported. He did admit that he doesn't have a plan. I won't claim we have a plan. I wish we had.
Yes, I heard that. I know that, and that's sad. It's terrible for the families who lose work. It is terrible for the health system in 2 ways. One, we're losing institutional knowledge and memory. 2, we are not reaching the people who need to be tested, who need to go to adherence club, who need to make sure that, especially people living with TB, getting their treatment on time, all the time. These are things that are necessary. And if that program slowly starts winding down, more infections will occur. People like myself and anyone else who's on ARVs at the moment, we are in a good place. We will get our medicines. It is the waiting lists that have already started going 2 months, 3 months, and longer in other provinces that we need to address.
What do you think stops or prevents the minister from accessing the 2 billion rands you're saying he can claim in terms of the PFMA?
I can't speak for the minister, but I can say this.
You can speculate.
I think I can speculate, and I'll speculate that the minister is fixating on other issues. I won't mention the 3 letters, but I think he's fixating on that. And this is a disruption. This comes as a blow to people who clinic has suddenly stopped, to people who've lost their jobs. The bewilderment, the fear is very strong. And for him to carry this burden on top of having come out of an epidemic where he turned around the HIV epidemic, to suddenly find himself in a situation where things can unravel is very sad. But he needs a plan. And Treasury, I'm absolutely sure, I can guarantee you, Treasury will fund when there is a plan.
Well, he did say that
I can guarantee.
He did say that he recently, met. I can't remember now whether he said last week or something, that he met with the Director General of Treasury, and what he told us today was all that they could come up with. Do you think But at the end of the day, it boils down to lack of will.
I think the minister's not being wholly truthful, and I think his mind is not on this program. But it's not only him alone. I would see Premier Windy, Gauteng Premier Lesofie, all the premiers, all the mayors. They need to be able to know what's going on in their health departments. They need to be able to lead us on this. And I promise you, we'll work hard.
Zackie, Achmat, let me thank you very much for your time. Really appreciate it.